Something dangerous and downright nasty is lurking in the produce aisle across America. Thousands of cases of Cyclosporiasis, which is a nasty stomach bug that causes explosive bowel movements, have been reported across at least 31 different states. While health officials try to nail down the exact source of where this parasite is coming from, let's ask the doctor about how to keep ourselves safe from it. I'm joined live by Dr. Peter Chin Hong, UCSF infectious disease specialist, here to help us understand cyclosporiasis just a little bit better. Thank you so much for joining us this morning.
Thanks for having me on, Mel.
31 states have been impacted. A lot of them are in the Midwest, but hasn't made its way here to California yet.
Well, we have a background cases of cyclosporiasis that happen every summer across the country. So California is kind of seeing an average year, maybe about 40 cases so far. Last year, we had about 80 cases this time. So we're actually doing a little bit better than last year. This is different from what's happening in Michigan, Ohio, West Virginia, Kentucky. That seems to be related to a big lot of cases from probably a single distributor that still needs to be identified.
Right, and I think I saw the latest number. It was like up to 4,700 cases. I mean, the number is pretty big right here. And so the stomach virus outbreaks, like you just said, I mean, really nothing new. I think last year, listeria, norovirus, those were the big ones that happened. But what sets Cyclospora apart from other bad bugs?
So the main difference is that it's a parasite, first of all, versus a virus or a bacteria. The second thing is that you don't get symptoms immediately after exposure, which is a challenge for trying to track down the source. So many other cases, a few hours later or 2 or 3 days, you get the symptoms. In Cyclospora, it takes up to a week or 2 weeks. And by that time, people may not remember. And in terms of the silver lining, although it's harder to diagnose than other foodborne illness, once you diagnose it, there is a treatment for it. It's antibiotic for 7 to 10 days. It's called trimethoprim sulfamethoxazole or Septra or Bactrim. You take it for 7 to 10 days and your symptoms go away.
That was a long name right there
I
for
know.
that. It's a
I almost
biotic.
fell asleep saying the name.
That was impressive, though. And then, okay, so when we're looking at the source of this, there's been a lot of theories about it. It seems like lettuce has been the big one that a lot of doctors have kind of pinpointed to. What do you think about that? So, and also just produce in general when we're buying it at the store.
Yeah, so the reason why lettuce is implicated is for two reasons. One, historically, green leafy vegetables have been the source of outbreaks before, as well as raspberries and other berries, green onions. And the reason why is because these are really hard to clean from soil. And if you think about how you get the parasite, it comes from stool. The stool contaminates like irrigation water or the soil that gets on the vegetables. And if it's hard to clean or you can't peel it off, that's how people get ill because running water alone doesn't eliminate risk, it reduces risk. And that's why, so many people are getting ill.
Well, also they were saying Taco Bell and other fast food restaurants. I mean, that is also potentially a source for that too. So that's something to keep in mind as well. And one of the big problems out there, I think you mentioned it too, is that people aren't going to the hospital to be treated. I mean, they're just kind of resorting to sitting on the, toilet, resorting to Pepto-Bismol, but they should be going to the ER when and why.
Yeah, so first of all, the very young, the very old, the main problem you can get from lots of diarrhea is dehydration. So in a very young, like a baby, that may mean being irritable, not feeding, not having as many wet diapers. So that might be a way to think about going in. For an older person, that may be seen as confusion, again, or organ failure, because if you have other comorbidities, that may lead you to be more sensitive to the effects of dehydration. And immune compromised people, even though they don't get it at a higher rate, once they get it, it's hard to shake off. So some people may have diarrhea for 4 weeks, for months, and I would say try to get a diagnosis
Yeah.
rather than suffering in silence.
Well, yeah, that's when it gets really, really dangerous right there. Well, hopefully we get to find the source here soon and we get more treatments out to people and this outbreak finally goes away because, man, I can't think of a worse way to spend your summer vacation than, on the porcelain throne right there for days on end. But thank you so much, Dr. PCH, for joining us this morning talking about cyclosporiasis, this bad bug going around here in the U.S. Thank you so much. We'll see you next time.
Bye, Mel.